I'm Toyoki Kudo from Northern Yokohama Hospital, Showa University in Yokohama, Japan. I'd like to present you the significance of the detection of early breast type lesions in the colorectum. And I'd like to verify the validity of using endocytoscopic classification as well as pit pattern in the colorectal lesions. The observation of the pit pattern of the colorectal lesions with magnifying endoscopy is very useful for the qualitative diagnosis and prediction of invasion days. Also, endoscopy, a ultra-high magnification system, can facilitate the observation of not only the structural appeal, but also cellular appeal in living colorectal regions. We have already reported that our endocytoscopic classification corresponds well with the pathological diagnosis. So we named it EC classification. And the breast type colorectal neoplasms are fairly rare, but have a prominent invasive tendency and are considered as candidates for precursors of de novo cancers. So it's very important to reveal the diagnostic characteristics of these lesions. So to clarify the features of early breast type colorectal neoplasms in comparison with flat and protruded type lesions, we demonstrated the validity of EC classification together with pit pattern diagnosis. A total of 12,895 colorectal lesions were treated at our center from April 2001 to June 2010. The correlations between size, morphological type, pit pattern, and the degree of invasion were variated. Of these, 323 lesions were stained with both 0.05 crystal violet and 1% Mexican blue, and were observed and classified into 5 groups according to EC classification using the integrated type endoscope. The rate of submucosal invasion in the breast type colorectal neoplasms reached to 62.2%, while that in flat and protruded type lesions were 3.6 and 3.4% respectively. In the region not exceeding 5 millimeters in diameter, the rate of submucosal invasion in the breast type colorectal neoplasms were 9.6%, whereas in flat and protruded type neoplasms were 0 and 0.02% respectively. And in those from 6 to 10 millimeters, the rate of submucosal invasion in the breast type colorectal neoplasms reached to 53.6%, whereas in flat and protruded type neoplasms were 1.6 and 1.5% respectively. And since the breast type lesions are already invasive, entering the submucosal layer at an early stage, so surgical treatment is often indicated, even for small ones. With regard to the diagnosis with magnifying endoscopy, so most of the flat and protruded type lesions were characterized by type 3L or 4 pit patterns, whereas most of the breast type colorectal lesions were characterized by type 3S or 5 pit patterns. Concerning endoscopy, most of the flat and protruded type lesions showed various EC images, whereas most of the breast type colorectal lesions showed type EC3 images correspond to invasive submucosal cancers. In conclusion, the breast type colorectal lesions are characteristic and important for their rapid growth and highly malignant nature. And the breast surface of the lesions typically presents type 3S or 5 pit patterns with magnifying endoscopy. Furthermore, present type EC3 images with endoscope. Thank you for your attention.